Musculoskeletal Radiology. Bone tumors. Metaphyseal tumors. Simple bone cyst. Location. Simple bone cysts are most commonly found in the proximal humerus, frequent finding in young patients with shoulder pain or injury. Radiological features. Simple bone cyst appears as a well-defined lytic lesion without any septations. It's a simple, hollow cavity within the bone. One of the key imaging signs to remember is the fallen fragment sign, which occurs when a pathological fracture causes a piece of bone to fall into the cyst. This is a classic feature seen on X-rays. Demographics. Simple bone cysts are most common in the first decade of life, primarily affecting children under the age of 10. It's a condition you should consider whenever a young patient presents with bone pain or a fracture at this site. Aneurysmal bone cyst, ABC. Demographics. Most commonly seen in the second decade of life, typically affecting teenagers and young adults. Radiological features. ABC has some classic features. First, it shows septations, which give it a soap bubble appearance on X-rays. On MRI, you'll see multiple blood fluid levels caused by bleeding inside the lesion. This is a characteristic finding that helps differentiate ABC from other bone lesions. Clinical note. Patients with ABC often present with swelling and pain. This is due to the expansile growth of the lesion, which can weaken the surrounding bone and sometimes lead to pathological fractures. Osteochondroma exostosis. Description. Osteochondroma is a bony outgrowth that grows away from the joint. It's covered by a cartilage cap, making it appear as an extension of normal bone growth. However, it's important to note that this is not a true bone tumor, but rather a developmental anomaly. Key features. When examining patients with multiple osteochondromas, you should consider diaphyseal achalasis, also known as hereditary multiple exostoses. This hereditary condition involves multiple bony outgrowths and is associated with an increased risk of complications. Risk of malignancy. Osteochondroma has potential for malignant transformation into chondrosarcoma. While this is rare, it's more likely in cases with multiple lesions or if the cartilage cap exceeds 1.5 to 2 centimeters in thickness. Investigation of choice. To evaluate the malignancy, the investigation of choice is MRI. Provides detailed imaging of the cartilage cap and surrounding structures. It's essential for assessing suspicious growth or changes. Osteosarcoma. Introduction. Most common primary malignant bone tumor. Most often seen in adolescents, particularly during their second decade of life. That's between 10 to 20 years of age. This is a critical growth phase when bones are rapidly developing, making this age group more susceptible to such tumors. Radiological features. 1. New bone formation, Codman's triangle. One key feature is new bone formation caused by the tumor's growth. This new bone formation can lift the periosteum, the outer layer of the bone, creating what we call a Codman's triangle. Imagine the periosteum being pushed upward, forming a triangular shape. 2. Sunburst reaction. Another classic radiological sign is a sunburst reaction. Spicules of bone radiate outwards from the tumor, creating a pattern that looks like the rays of the sun. This happens because the tumor forces bone to grow in an irregular outward pattern. 3. Dense matrix. Additionally, you may notice a dense matrix on the imaging. This indicates aggressive growth and abnormal bone formation by the tumor. Multiple enchondromas. Introduction. Enchondromas are benign cartilage tumors that develop inside the bones, and when they occur in multiple numbers, they can lead to characteristic changes in the skeletal structure. Hallmark feature. The hallmark feature of multiple enchondromas is the expansion of short tubular bones of the hand. On imaging, these bones appear widened or show stippled calcification, which are small, spot-like areas of calcification seen within the tumors. Types. 1. Allier disease, characterized by the presence of multiple enchondromas without any other associated abnormalities. The enchondromas are often asymmetrically distributed. Metaphyseal syndrome. Patients have multiple enchondromas, just like Allier disease, but with an additional feature, the presence of hemangiomas, which are benign tumors made up of blood vessels. These hemangiomas can be seen in the soft tissue, adding a vascular component of the disease. Other important tumors. Fibrosis dysplasia. Introduction. Developmental bone disorder, where normal bone is replaced by fibrous tissue, leading to characteristic features on imaging and clinically. Radiological features. Fibrous dysplasia typically presents with a ground glass matrix in the metaphyseal region of the bone. A common example is the femoral neck, where this appearance is often seen. The term ground glass refers to the hazy, frosted look of the lesion on X-ray imaging. Another key radiological feature is the Rin sign. This is a sclerotic rim, or a thickened, dense border that surrounds the lesion. It acts as a boundary between the fibrous lesion and the surrounding normal bone. Clinical features. Fibrous dysplasia can weaken the bone, sometimes leading to a pathological fracture. One classic deformity that results from repeated fractures and bowing of the femur is a shepherd's crook deformity. Fibrous dysplasia can also involve multiple bones, and, in such cases, we call it polyostotic fibrous dysplasia, which simply means multiple bones are affected. Associated syndromes. 1. McCune-Albright syndrome. Fibrous dysplasia is sometimes part of a syndrome called McCune-Albright syndrome. This condition is associated with precocious puberty, along with other endocrine abnormalities, such as thyroid or adrenal issues. 2. Mausbrod syndrome. Another associated condition is Mausbrod syndrome, where fibrous dysplasia is seen along with soft tissue myxomas. These are benign tumors made of gelatinous connective tissue that can occur in the soft tissues near the affected bones. Spinal hemangioma. Common location. Spinal hemangiomas most commonly occur in the vertebral body. These lesions are made up of blood vessels, and their characteristic appearance helps in identifying them on imaging. Radiological features. 1. Jail bar or corduroy cloth appearance. On sagittal views, spinal hemangiomas show a classic jail bar appearance, also referred to as the corduroy cloth appearance. This is because the lesion has vertical striations that look like the vertical ridges on corduroy fabric. 2. Polka dot sign. On cross-sectional imaging, such as CT or MRI, the lesion presents a polka dot sign. This pattern arises because the lesion is seen in a cross-section of the vertebral body, with dots corresponding to thickened vertical trabecula. Clinical note. Spinal hemangioma is the most common benign lesion in the spine. While these lesions are usually asymptomatic, they can sometimes cause back pain or, in rare cases, lead to neurological symptoms if they grow large enough to compress nearby structures. Typical appearance of a vertebral hemangioma with thickening of the primary vertical weight, barring trabecula, leading to corduroy appearance on lateral projection and salt and pepper or polka dot sign appearance axially. Note the fat density marrow. That's all for the video. We'll see you next time.